As I grew older, I started to realize that I used to get more frequent injuries, things that I'd explain away as just getting a stiff neck in the morning, started becoming more frequent, and I actually had to kind of like help myself by going for massages very regularly. It got worse and worse, especially when I started my new job, a desk-bound job, and it came to the point where I had to do a massage once a week, just to relieve the pain. So, and then when I start the weekday again, and then the pain would start to build up until the weekend. And if I don't get the massage in, I'm miserable by that stage.
Back then, I'll go for a massage. I go for some of those deep tissue massage. It'll help to relieve the pain temporarily. I also have taken some pain reliever, muscle relaxant, but I feel that only works for a short amount of time. Actually, I don't really like to take it for too long.
The easiest way is to take a pill. So of course, if when you're traveling so much and you don't have time for self-care and to get professional help, pills I used to take muscle relaxants, painkillers. You kind of know that they're not the right long-term solution, but for the short term, those give you the temporary relief. At least it's not so tense. The other one, the other solution that I always go for is massage. Ladies like massages, and it's so nice after you've had someone work really hard in your deep tissues.
If I've been quite desk bound and I'm really in pain, and then a series of daily exercises. Those are really stretching and exercises to really help me get movement again. That's the main thing that really helps me cope.
Generally, I'd stay away from medication. I try to avoid taking medication if I can. There were some exercises that a massage therapist had given me a number of years ago that basically was a lot of movement in your upper body to get the blood flowing through. But that was really only a temporary relief. Didn't ever really give me any long-term relief, and it never, again, didn't fix the core problem. It was still there. It was just, making me feel a little bit better.
When I was younger, it was just impromptu self-massages. Somebody recommended some kind of neck collar to me, which I found really uncomfortable, but it seemed to work for some people, so I gave that a shot, but you can't be caught dead walking around with it. It was, I honestly have never taken pain relief just for the neck and shoulders. Maybe rubbed a little bit of, those balms or any kind of off-the-counter pain medication for it, but I never took it so seriously because, again, it's never been something that would be debilitating for me. It's not been something that would prevent me from getting up and doing what I do.
I was seeking relief in any avenue that I could. And I tried all those other things, and doctors just always told me, the regular GPs would just always tell me that, it's just tenseness in your muscles, and I mean, they never had any permanent answer for me. Their answer was always this pill or that pill, and it will relieve the pain, and then you'll be better after that. But, it doesn't last long, and then it comes back again. So I was just constantly searching for ways to have a more permanent form of relief.
I'm a health coach as well. So as I learned more and more about my own body and more about different approaches, I strove to look for longer term solutions. And I call physiotherapists and chiropractors my friends because the human frame is very important. Understanding how your muscles work is very important. So as I dealt with the problem over time, I decided to take a different approach because drugs and pills for me are not the way, and certainly not the long-term solution.